Okay, so we've got Kenny Rogers today. He is a male, 78-year-old. His birthday is 10/29/47. He's a full code. It doesn't have any allergies listed in here. Go to his orders. And he has an order for the insertion of a urinary catheter for now. I'll go to his notes. And I see he has a neurogenic bladder, so we'll kind of assess that and see what kind of symptoms he has. And then I do see he has an order to have a straight catheter at home once he's discharged, so I'll also kind of educate him on that. We'll close the chart and we'll grab some supplies. So I've got my Foley catheter kit, 12 French, is intact, not expired, tape, lubricant. Okay, knock knock.
Come in.
Hello.
Hi.
My name's Tiffany. I'll be your student nurse today.
Hi, Tiffany.
Hi. Let me just get some of this on. I'm going to close the curtain for some privacy.
Okay.
Okay. Can you tell me your name and date of birth?
Kenny Rogers, 10/29/1945.
Okay. I do see on your bracelet that the birth date doesn't match, but the one you verbalized does match, the one we have on our record.
Okay.
So I'll go ahead and have admissions get us a new bracelet with that correct birthday, okay?
Okay.
All right. So I'm just gonna ask you a couple questions. Are you allergic to any latex or adhesives?
No.
No. How about any environmental or food?
No.
How about any betadine or iodine?
I'm allergic to iodine.
Iodine. What happens when you're in contact with that?
I get rashes.
Rashes. Okay, I'll update that in your chart. And then, are you allergic to any medications?
I'm not.
Okay. All right. Awesome. So I just have an order to put in a urinary catheter. Have you ever had one of those before?
I have not.
No. Okay. So what that is it's a thin plastic tube. We will insert that through your urethra, and it'll sit inside your bladder. What that's going to do is it's going to drain the urine from your bladder into a bag that I secure down here, and that way if you need to, like, it's just going to do it itself. You don't have to do anything to void or urinate.
Nice.
Basically. Yeah. So let me just ask a couple questions. I did see that you have what's called a neurogenic bladder. Have you been having symptoms like not being able to control your bladder with that?
Yeah, I've just been kind of peeing everywhere.
Yeah. Yeah. Okay. And when it does happen, do you notice any like color, any smell to it?
It smells strong, and I think it's pretty dark.
Pretty dark. Okay. So, when it happens, is there any pain with that, or can you tell?
I can't feel anything at all down there.
Okay. Well, that's good. No pain. So yeah, with this catheter, basically, since you kind of can't control your bladder, it's going to help you not even have to worry about that. So like I said, it'll just go from your bladder to the bag.
Okay.
Yeah, it's pretty nice.
Awesome.
Perfect. I'm going to raise you up a little bit, and I'm just going to do a little more assessments, okay?
Okay.
All right. And with these assessments, is it okay if I expose you a little bit?
Yeah, that's fine.
Okay. Alright, I'm gonna go ahead and expose you. Oh my gosh. Okay, so I'm just gonna inspect your abdomen and bladder area. Doesn't look like there's any discoloration, no redness, no rashes, no cuts, no bruises. Feels warm. And then same thing with your genitals. Doesn't look like there's any rashes or redness, any lumps or bumps or cuts, and no discoloration, so that's good. I'm gonna go ahead and palpate your bladder. You let me know if there's any pain or tenderness with that, okay?
Okay.
Anything here?
I feel something.
How about here?
Yeah, that feels
Yeah, and
painful.
here?
Yeah, that's something.
Okay. Is it pain or is it just like kind of tender when I touch it?
I think it's tender.
Tender. Okay, that's fine. So, I'm gonna kind of do some pericare before we get started. All that is I'm just gonna clean the genital area, okay?
Okay.
Is it okay if I assist you into a better positioning for that?
Please do.
Okay. Alright, so this is my clean, soapy, warm water. This is my dry. So, I see that you are circumcised, but if you weren't, we would just be retracting that foreskin, okay?
Okay.
Alright, one around the head. And there. There. One under. And this is our dry. Now I'm just going to keep you exposed like this for the remainder of the time. But don't worry, close the door. It's just me and you.
Okay.
I'm just going to set up my stuff over here, okay?
Okay.
All right. Okay, so this is my catheter kit. It's intact, not expired, 12 French. So go ahead and open that. I'm just gonna bring this a little more. So away. Sides towards me. Okay, I'm gonna come around. Grab these. That's up there. Again. Oh. And we'll grab them here. Don't need that. I'll grab this guy here. Okay, and so this is just a absorbent pad. I'm just gonna set it underneath you. This is just gonna keep you as clean as possible, okay?
Okay.
Okay. Go ahead and put these gloves on. back over here. I'm going to grab this and this. We're gonna get rid of that. We're gonna grab this. Get rid of that. Okay, let's see. I'm going to open these and we're gonna set these here. Close that. And set this guy here. Stay. Okay. Okay, lubricant. This is my sterile lubricant. It's been in the kit the whole time. We're gonna set you over here. I'm gonna lift this. Oh God, I'm gonna come around. This tubing a little bit. There we go. Okay. All right, so now we're gonna move this over to our patient. All right, you ready?
Yes.
Okay, so like I said, you aren't circumcised. No, you are circumcised, but if you weren't, I'd be retracting that foreskin and replacing it after the procedure. But we don't have to worry about that. I'm gonna commit this hand, and we're just gonna clean you first, okay?
Okay.
So, one done. Okay. And we're just gonna lubricate the tip 6 to 7 inches, but I'll be holding it 3 to 4. And I want you to just take a deep breath. Ready? Good job. We're gonna go all the way to the bifurcation. Okay, and I'm gonna hold that. I'm gonna inflate the balloon. Still feel okay?
Yeah.
Yeah. I see it's already draining, so that's good.
Good.
Yeah. Okay. Now I'm gonna pull that out to resistance. Good job. Feel good?
I feel all right.
Yeah, a little uncomfy, but shouldn't be any pain.
Yeah, I don't feel anything, so.
Okay. I keep forgetting, that's my bad.
It's okay.
Okay, so let me just get some new gloves in. And I'm gonna connect that to your leg, and then we'll connect the bag to your bed below your bladder. Okay. So we're gonna connect it to your upper thigh. Oh God. No. Oh my gosh. Okay, we're gonna grab a new piece of tape. Let me just use this other way for now. But we're gonna connect it to your upper thigh to where it's not pulling, but it still gives you some movement or some room to move, okay?
Okay.
And then we'll connect the bag down here, like I said, below your bladder. It should be a, there it is. Oh God.
Oop.
Okay. Perfect. That's so good. Okay, let me get this stuff out of your way here. And I'm just gonna perform some more of that pericare, okay?
Okay.
So, here's my new bowl of warm soapy water. This is my dry. We're gonna do one on the head, one on the side, other side, low. And then we're gonna dry. All right. You did great.
You did great.
I tried. Okay. So yeah, I'm gonna move you back into a comfortable position. Is that okay right there?
That's just fine.
And then I'm just gonna get rid of my trash here. Got it. Oh, wait. And then I'm gonna go over some information with the catheter, okay?
Okay.
All right. This looks crazy. There we go. Okay, so just gonna get rid of this for policy. Not sure that's gonna out, actually. Okay, so with this catheter, like I said, it's gonna stay in place for the remainder of your stay.
Okay.
It'll drain on its own. I'll keep an eye on how full it gets, and I'll continue to drain it. Looks like it's already getting pretty full, so I'll go ahead and drain that before I leave. If you feel like you want to change positions or sit in the chair, that's fine. Just push your call light button, and that way I can assist you to do that safely without accidentally pulling out that catheter, okay?
Okay.
Another thing is I did notice that you have orders to go home with a straight catheter after you're discharged. So I'll kind of just go over that. That is basically the same idea. It's used to drain the bladder. The only difference is it won't stay in your bladder. That one, you only insert it when you're draining and you take it out when you're done. It's pretty easy. Other than that, do you have any questions for me at all?
No, I'm good.
Okay. Yeah. You should be good then. I gave you your call light. Checked your all the way down. It's locked. Here's your table back. All right. You just click that button if you need anything, okay?
Yes, ma'am.
All right. Thank you.